Abnormal behavior. The DSM-5 is the Diagnostic and Statistical Manual of Mental Disorders. It is the 5th edition and classifies over 300 specific disorders. It lists symptoms for each mental disorder and is designed to generate a valid and reliable diagnosis. The cognitive perspective believes that individuals have faulty, illogical, and negative ways of thinking. For example, if someone has unrealistic negative thoughts, it could lead to depression. However, humanistic perspective looks at a person's self-concept, feelings, and self-esteem for the cause of abnormal behavior. For example, anxiety could result when individuals experience a gap between their ideal self and their real self. The behavioral perspective stresses that abnormal behavior is learned. For example, during classical conditioning, if you're stuck in an elevator and the power goes out, this could become a conditioned stimulus that elicits anxiety. Biological perspective argues that many different disorders are caused by inherited predispositions, hormonal imbalances, neurotransmitters, or differences in brain structure. For example, imbalance of chemicals that influence the nervous system or the endocrine system can cause anxiety. The psychoanalytical perspective views disorders as a result of intrapsychic conflicts between the id, ego, and superego. These conflicts can result from unresolved traumatic experiences from a person's childhood. For example, if someone was rejected, this can produce feelings of anger. The psychoanalytical perspective views depression as anger that is channeled into the unconscious. The characteristics of anxiety disorders. Anxiety is the feeling of apprehension, tension, and worry that occurs from the pressures of life or a personal crisis. Pathological anxiety, however, is uncontrollable, irrational, and disruptive. All anxiety disorders include extreme levels of fear and anxiety that negatively impact cognitive processes and behavior. Some main anxiety disorders include panic disorder, generalized anxiety disorder, phobias, and agoraphobia. Generalized anxiety disorder. Some traits include a persistent, uncontrollable, and ongoing apprehension that deals with a wide range of life situations. It affects women twice as much as men and can lead to irritability and chronic fatigue. Panic disorder. Characterized by sudden episodes of extreme anxiety called panic attacks, and the constant concern about having future attacks. Some characteristics include rapid breathing, a pounding heart, lightheadedness, and sudden dizziness. Phobias are a strong irrational fear of certain objects or situations that are harmless. For example, Howie Mandel, a well-known comedian, television host, and actor, has mysophobia, a fear of germs. Howie refuses to shake hands with his contestants and instead exchanges them for fist bumps. Agoraphobia is the irrational fear of open spaces due to the concern of not being able to get help if needed. Agoraphobics avoid crowded locations such as airports, stores, concerts, or college campuses. In extreme cases, agoraphobics are unable to leave their house altogether. Characteristics of obsessive-compulsive and related disorders. Some main traits include unwanted thoughts producing anxiety and repetitive behavior. Some main disorders are obsessive-compulsive disorder, body dysmorphic disorder, hoarding, and trichotillomania, a hair-pulling disorder. Obsessive-compulsive disorder are unwanted thoughts called obsessions producing repetitive behavior called compulsions. Individual must do these in order to reduce the feeling of anxiety. It can become very time-consuming and cause significant distress. Some compulsive behaviors could include excessive washing, repeatedly checking to make sure that doors are locked, or turning lights on and off. Hoarding is persistent difficulty and distress with having to give up possessions and an excessive need to save items with or without value. These behaviors could disrupt normal functioning in family, occupational, and social settings. It could also cause significant levels of personal distress. Characteristics of trauma and stressor-related disorders. These disorders could develop by an exposure to a stressful or traumatic event. Some main disorders can include post-traumatic stress disorder and acute stress disorder. Post-traumatic stress disorder develops from exposure of actual or threatened death, serious injury, or violence resulting in helplessness and horror. Some symptoms include involuntary, recurring, and distressing memories of the event. This could lead to anxiety, uncontrollable crying, depression, edginess, and inability to concentrate. It could also develop if someone has learned about a traumatic event that happened to a family member or a close friend. Characteristics of depressive disorders. Depressive disorders are disturbances in a person's emotions that causes sleep problems, loss of pleasure, negative thoughts, lack of concentration, and suicide ideation. This can affect the person's ability to function and can cause psychological discomfort. Some main disorders include major depression disorder, persistent depressive disorder, also known as dysthymia, and disruptive mood dysregulation disorder. Major depressive disorder. People often describe feeling deeply discouraged, lethargic, and having a continuous depressed mood. William Styron, a prize-winning author, describes his depression as being a poisonous fog bank rolling in upon his mind. Approximately 10% of people attempt suicide. For example, Kurt Cobain, the lead singer and guitarist of the band Nirvana, had a long history of depression and committed suicide in 1994 at the height of his fame. Characteristics of bipolar and other related disorders. Traits include periods of both depression and mania or hypomania. Some main disorders include bipolar 1, bipolar 2, and cyclothymic. It was formerly considered as types of mood disorders, but made into a separate category. Bipolar 1 disorder. Individuals suffer from racing thoughts called flight of ideas, inflated sense of importance, and shortened attention span. An individual during a manic episode is hyperactive and may not sleep for days at a time. Many famous writers and artists had bipolar disorder. Some include Vincent van Gogh and Edgar Allan Poe. Characteristics of somatic symptom and related disorder. They are characterized by having significant personal distress and impairment from physical complaints or conditions. Some main disorders include somatic symptom disorder, conversion disorder, and factitious disorder. Somatic symptom disorder. This disorder shows physical complaints that prevent normal functioning or is extremely distressing. Individuals may experience persistent symptoms that can or cannot have a known medical cause. They have an exaggerated concern about their health and illness and may frequently meet up with physicians and devote excessive amounts of time to researching symptoms and illnesses. Conversion disorder. Individuals can experience blindness, paralysis, deafness, and other loss of motor or sensory control with no physical cause. Symptoms result in impaired functioning and significant distress. The importance of schizophrenia. It affects approximately 1% of the United States population. It also affects half the people that are admitted into mental hospitals. Schizophrenia, most commonly seen, begin during early adulthood or late adolescence. It rarely emerges prior to adolescence or after the age of 45. Delusional beliefs. They are far-fetched or bizarre beliefs that continue even though there is evidence contradicting it. Most people that suffer from schizophrenia often experience delusions of persecution or delusions of grandeur. Delusions of persecutions are thoughts of aliens, spies, or people trying to harm them. Delusions of grandeur are people perceiving themselves as all-powerful or important, such as an Old Testament king or a modern ruler. Hallucinations. False or distorted perceptions that are vividly real to the persons experiencing it. Hallucinations can be olfactory and visual. Individuals tend to hear voices that tell them what to do or comment on their behavior. Disorganized speech and thought. Individuals often jumble words or phrases together or make artificial words, called word salad. The most common thought disturbance is the lack of contact with reality. Emotional and behavioral disturbances. Individuals suffering from schizophrenia will go from an inappropriate and exaggerated reaction to a flat and emotionless expression on their face. They will experience wide range and unusual behaviors. For example, they could be shaking their head to get rid of unwanted thoughts to an immobile stance for a long period of time. Schizophrenia explained. The dopamine hypothesis. Some forms of schizophrenia could be caused by the overactivity of dopamine in the brain. Certain drugs can increase the dopamine in the brain, making symptoms worsen, just like how certain drugs can block the dopamine going into the brain, reducing the symptoms. The diathesis stress model. The diathesis stress model. Individuals can have an environmental or inherited predisposition that can increase the risk of getting schizophrenia. Schizophrenic episodes can be triggered by stressful life experiences. Schizophrenia explained continued. The genetic basis. Individuals who have shared genes with a person who has schizophrenia are more likely to develop it. For identical twins, if one of them develops schizophrenia, the other twin has a 48% chance of developing it as well. Adoption studies have shown that if a biological parent has schizophrenia, the child that has been adopted is at a greater risk of developing it. Characteristics of personality disorders. Well-adjusted people are able to modify their personality traits as well as adjust to different social experiences, whereas individuals with personality disorders become maladaptive and inflexible across a broad range of situations. Personality disorders are more likely to form during the adolescence or early adulthood. Some main disorders are narcissistic personality disorder and antisocial personality disorder. Narcissistic personality disorder. Individuals suffering from this disorder have a huge sense of self-importance, need for excessive admiration, fantasizes of unlimited success, and are willing to exploit others to achieve goals. The causes of narcissistic personality disorder are still unknown. However, an important factor researchers believe is an excessive admiration that was never balanced with realistic feedback. Antisocial personality disorder. Individuals suffering from this disorder disregard and violate the rights of others. They lack a conscience and show no remorse. When confronted on their destructive behavior, they are surprisingly poised. Approximately 6% of men and 1% of women show signs of antisocial personality disorder. Some classic examples of people with antisocial personality disorder are serial killers, politicians, and business people. Characteristics of dissociative disorders. This involves splitting apart important aspects of a person's memory, awareness, and identity. Individuals who experience dissociative disorders have a need to escape the stress or anxiety. Some main disorders include dissociative identity disorder and dissociative amnesia. Dissociative identity disorder. This is the presence of two or more different personality systems in an individual. Each personality has their own memories, self-image, name, and behaviors. Many mental health professionals and researchers wonder if dissociative identity disorder is a genuine disorder. Skeptics believe many of the cases are not supported by scientific evidence. Dissociative amnesia. Total or partial inability to recall past experiences, important information, and autobiographical information. Individuals may have amnesia for specific events or their whole life history or personal identity. This is caused by stressful situations or traumatic events, such as military combat. It may be accompanied by a dissociative fugue, which is inexplicable or sudden travel associated with amnesia. The pseudopatient experiment, also known as the Rosenhan study. In 1973, David Rosenhan went to 12 different psychiatric hospitals in 5 different states with 7 other mentally healthy people. To get into the hospital, they claimed to be hearing voices, but other than that, acted normally. They were diagnosed with schizophrenia, but one was diagnosed with a manic-depressive psychosis. While other patients realized they were mentally healthy, professionals failed to see it was a ruse and instead used schizophrenia as a characteristic for their behaviors. The significance of the Rosenhan study. Rosenhan study showed that having a diagnostic label can result in distortions of the meaning of someone's behavior. For example, when a pseudopatient wrote down notes, the staff perceived this writing behavior as another manifestation of the underlying pathology. After the report was released, many people have debates on the positive and negative consequences of diagnostic labels.